What happens if you ejaculate every day? It's a question many men have thought about, but might be hesitant to ask. In a world filled with conflicting information, it's difficult to know what's healthy and what's not. Is it a sign of a healthy libido, or could it be too much of a good thing? Today, we're going to address this topic directly. We'll present a balanced, fact-based perspective on the science behind daily ejaculation. We won't provide a straightforward yes or no answer, because the reality is far more nuanced. Instead, we'll examine both the potential benefits and the possible problems linked with this. Frequency. If you haven't already, make sure to subscribe and turn on the notification bell so you never miss out on vital health tips that could actually change your life. We'll begin by highlighting 5 potential benefits that research indicates could come from ejaculating daily. Then, we'll switch gears and examine 5 potential problems you should be mindful of. By the end of this video, you will have a considerably clearer understanding of how this very personal habit might influence your physical and mental health. Let's begin with the positives. What are the potential benefits of ejaculating every day? First, it stimulates the production of pleasure hormones. When you ejaculate, your brain produces a cocktail of feel-good chemicals. These include endorphins, your body's natural painkillers and mood boosters. You also receive a surge of dopamine, a neurotransmitter connected with pleasure and reward, and oxytocin, often referred to as a love hormone, which encourages bonding and relaxation. Finally, there's serotonin, which aids mood regulation and contributes to feelings of well-being and happiness. This hormonal release explains why you often feel relaxed, happy, and content after an orgasm. Regular release of these hormones can lead to improved overall mood and reduced stress levels. The second advantage is improved sleep. If you've ever felt drowsy after ejaculating, you're not alone. This is primarily due to the release of a hormone called prolactin. Prolactin induces feelings of calmness and sleepiness, which is why many men find it easier to fall asleep after sex or masturbation. The same pleasure hormones we just mentioned, like oxytocin and endorphins, also help lower stress and encourage a state of calmness, making it easier to drift off. For someone who struggles with insomnia or restless nights, this natural sedative effect can be a significant benefit, leading to improved quality sleep and, consequently, more energy throughout the day. Third on our list is the enhancement of vasodilation, which simply means a widening of your blood vessels. During sexual arousal and orgasm, your heart rate rises and blood flow improves throughout your entire body, not just your genitals. This process helps your blood vessels expand, which is advantageous for your cardiovascular system. Enhanced blood circulation ensures that oxygen and nutrients are efficiently delivered to all your organs and tissues. Over the long term, this could lead to better heart health and may even help lower blood pressure. Think of it as a mini exercise for your circulatory system. If you're serious about these health benefits, type GLOW in the comments. Just one word, GLOW. It's a small word with big meaning, and it lets us know you're all in. The fourth benefit is one of the most frequently discussed: a reduced chance of prostate cancer. Several major studies have investigated this connection. The most notable one, a long-term study from Harvard University, tracked over 30,000 men for nearly 2 decades. The results, published in the journal European Urology, reveal that men who ejaculated frequently, specifically 21 or more times per month, had a substantially lower risk of developing prostate cancer compared to those who ejaculated less frequently. The leading theory is that frequent ejaculation helps flush out the prostate, clearing it of potentially harmful substances and old cells that might otherwise build up and become cancerous. While it's not a guarantee, it's convincing evidence that regular ejaculation plays a protective role for the prostate. If you're serious about these health benefits, type GLOW in the comments. Just one word, GLOW. It's a small word with big meaning, and it lets us know you're all in. The fourth benefit is one of the most frequently discussed: a reduced chance of prostate cancer. Several major studies have investigated this connection. The most notable one, a long-term study from Harvard University, tracked over 30,000 men for nearly 2 decades. The results, published in the journal European Urology, reveal that men who ejaculated frequently, specifically 21 or more times per month, had a substantially lower risk of developing prostate cancer compared to those who ejaculated less frequently. The leading theory is that frequent ejaculation helps flush out the prostate, clearing it of potentially harmful substances and old cells that might otherwise build up and become cancerous. While it's not a guarantee, it's convincing evidence that regular ejaculation plays a protective role for the prostate. Finally, the fifth advantage is a boost in your immune system. You might not consider ejaculation as a way to fend off a cold, but some research indicates it can help. Studies have demonstrated that sexual arousal and orgasm can elevate the levels of certain antibodies like immunoglobulin A or IgA. IgA is one of your body's initial defenses against viruses and bacteria. Additionally, the stress-reducing effects of orgasm also play an important role here. Chronic stress is known to weaken the immune system, making you more susceptible to illness. By helping to reduce stress levels, regular ejaculation can indirectly promote a stronger and more responsive immune system, helping you remain healthier overall. Now that we've discussed the potential upsides, it's necessary to consider the other side of the coin. What are the possible problems or downsides of ejaculating every day? The first potential concern is that it might become a psychological compulsion. It's important to differentiate between a healthy habit and a compulsive behavior. If you enjoy ejaculating daily and it doesn't negatively affect your life, it's probably not an issue. However, if you experience an overwhelming urge to do it every day and it begins to interfere with your work, your social life, or your responsibilities, it might be developing into a compulsion. Compulsive behavior is characterized by a lack of control, where the act is no longer a choice, but a perceived necessity. This can lead to feelings of guilt or shame and might signal an underlying psychological issue. Second, it might be used as an emotional crutch. Many people resort to masturbation and ejaculation to cope with feelings of stress, anxiety, fear, or sadness. The release of pleasure hormones offers temporary relief, making it an effective, short-term coping mechanism. The issue arises when this becomes the only method you have for managing negative emotions. Using ejaculation as an emotional crutch can stop you from developing other, more sustainable coping strategies, such as exercise, meditation, or talking to a friend or a therapist. It masks the deeper problem without genuinely solving it, which can be harmful to your long-term emotional health. Following along so far? Type 1 in the comments and hit the like button now. It lets us know you're engaged and helps others find this helpful content too. The third potential issue relates to fertility, specifically a reduction in the quantity of sperm in the semen. Your body requires time to produce and mature sperm. While production is continuous, a full recharge can require around 72 hours. When you ejaculate daily, your body doesn't have adequate time to replenish its sperm reserves to maximum levels. This results in a reduced sperm count per ejaculation. For most men, this isn't an issue. However, if you and your partner are actively trying to conceive, ejaculating daily might lower your chances of success. In this particular scenario, spacing out ejaculations by 2 to 3 days can help ensure a higher concentration of sperm, increasing the likelihood of fertilization. Fourth is a possible decrease in desire. While it may seem counterintuitive, ejaculating too frequently can sometimes result in lower libido. This is partly due to the brain becoming accustomed to the continuous release of pleasure hormones. If your brain's reward system is continually being activated, it might become desensitized. Over time, meaning you require more stimulation to achieve the same level of pleasure, and your overall spontaneous desire might decrease. Additionally, there's a refractory period, the time a man needs to recover after an orgasm before he can become aroused again. While this period varies, constant ejaculation can keep your desire at a lower baseline. Sometimes, a short interval of abstinence can help reset your system and reignite that sexual spark. The fifth and final potential issue is that it might contribute to premature ejaculation and erectile dysfunction. This is especially true if daily ejaculation happens through rapid masturbation. If you get into the habit of rushing to the finish line as swiftly as possible, you're essentially training your body and brain for a sprint, not a marathon. This conditioning can be difficult to unlearn and often translates into premature ejaculation during partnered sex. Moreover, this can create a cycle of performance anxiety. Worrying about lasting longer can, in some cases, lead to psychological erectile dysfunction, where the fear of not performing adequately makes it difficult to get or maintain an erection. The focus shifts from pleasure to performance, which can harm a healthy sex life. To summarize, what happens if you ejaculate every day? As we've explored, it's not a straightforward question with a simple answer. It's a complex topic with a range of potential effects. On one hand, it can offer meaningful benefits, from enhancing your mood and improving your sleep to potentially decreasing your risk for prostate cancer and strengthening your immune system. On the other hand, it carries possible risks, such as developing a psychological compulsion, using it as an emotional crutch, or contributing to fertility and sexual performance concerns, like premature ejaculation. Ultimately, the key is balance and self-awareness. There's no magic number that's correct for everyone. The most important factor is to listen to your own body and mind. If ejaculating daily makes you feel good, reduces your stress, and doesn't disrupt your life, then it's likely a healthy practice for you. However, if you sense it become a compulsion, if you're using to avoid dealing with your emotions, or if it's causing issues in your sex life, it might be time to reassess. If you have any concerns about your sexual health, it's always wise to speak with a doctor or mental health professional. Before you go, pause for a second. If you found this helpful, subscribe and turn on the bell for more expert health tips. What part of the video helped you most? Your comments inspire us to keep making content that supports your health. If you're finding this video helpful, type 1. If not, type 0. We use this to better serve your needs. Don't forget to share this with someone who might benefit too. Your health journey matters, and we're here for it.